Hi, Sherry Wirtz with Dental Hygiene 411. Today's 411 is preparing for your pregnancy. Optimal oral health ideally begins before you even get pregnant. But if you're already pregnant, let me congratulate you. It is an exciting time of your life. But oral health is not something you hear a lot about during pregnancy. When we talk about health, we talk about eating right, getting enough sleep, and taking vitamins during your pregnancy. But your oral health is really important because poor oral health can cause low birth weight, premature delivery, preeclampsia, and even gestational diabetes. Hormonal changes happen usually in your first trimester, and because of those hormonal changes, you can get gingivitis, which is inflammation of the gums. So if your gums are healthy and you've seen a dentist, then that's great. You're on your way. And hopefully you're brushing 2 times a day. I am a Burst ambassador, so I'm going to show you the Burst toothbrush. And I like this brush because I know it's kind of hard for me to focus, but these bristles are tapered and they go a little further below the gum line. When you're brushing, you want to start a routine brushing 2 minutes twice a day. And again, it doesn't matter if you use a regular toothbrush, an electric toothbrush, an Oral-B, a Sonicare. What matters is how you use the toothbrush, that you angle it towards the gums. And if it's a manual toothbrush, you're going to go in a circular motion and massage the gums. If it's an electric toothbrush, I like to start with a routine that I always do the same thing, so you get it in your mouth. You want to make sure that you're not too closed or not too open so you can get these back teeth back here. You're going to angle it towards the gums and hold it for 3 to 5 seconds and then go to the next spot. Just making sure that the bristles are getting below the gum line and brushing the teeth and the gums at the same time. I do all of the tops on the outside, turning the brush when I get to here and then going around. Once I do all of the outsides, then I will open up and get the insides and the tops. So if I show you on the bottom, if you kind of come over the top, you can just angle it on the inside or the outside. So you're getting the outsides, the top sides, and the insides. And I'm kind of doing this a little fast, but you just want to hold it, making sure that the bristles are getting along the teeth and the gums at the same time. This will give you time, if you have gingivitis and you have any areas that are bleeding, just hold the brush there a little bit longer until that stops. It may take 3 to 7 days depending on how puffy your gums are. But you're just going to keep doing that both on the inside and the outside. And when you're down on the bottoms or the tops, you can kind of hold the toothbrush this way to get the insides a little easier than holding it to this side. Although this Burst toothbrush is the perfect size to fit this direction, I like to hold the toothbrush this way. So this is just a little bit about brushing and making sure that you're getting all of the gums and all of the areas of the teeth. So the outsides, the top sides, and the insides, and how you hold the toothbrush in a modified BAS, meaning that you're massaging the gums and brushing the teeth at the same time, is important. If you haven't had a dental checkup, please go and find out what your numbers are. Numbers are when they measure the gums. 1, 2, and 3 are normal, healthy measurements. 4 means you may have a little bit of gingivitis or early gum disease. Gingivitis is inflammation of the gums and you haven't had any radiographic bone loss or you haven't had any bone loss in your mouth. If you have 4s and 5 millimeters and you have had bone loss, you may have periodontal disease. If you have periodontal disease, the bacteria involved with that can get in your bloodstream, and that's what can affect your baby. So there's different things that you can do. If you have that bacteria also, you may be more susceptible to getting cavities because you may have a hard time brushing. You may be experiencing morning sickness. I know that I had morning sickness my first trimester and I could not use toothpaste. So I just used a brush wet without toothpaste. And it took me a while to figure out that I could do that and be able to brush. So I also was on bed rest at the end. So I definitely had some pregnancy gingivitis, which I was a little embarrassed about because I'm a hygienist and I was thinking I should not have pregnancy gingivitis. So it happens to all of us. You just need to brush a little longer and take good care of your teeth. So if you have gingivitis or gum disease, periodontal disease, you definitely want to get your teeth cleaned every 3 months during your pregnancy. So that way your dental hygienist and your dentist can tell you where you're missing, what areas you need to work on, and you can have a healthy mouth during your pregnancy because a healthy mouth is a healthy baby and you want to give your baby the best start to life possible. So thanks for watching, and as always, hope this was helpful. Have a great day.